Somber news sparking a conversation. Are we doing enough to prevent cancer deaths?
13 WREX's Destin Howard starting off our coverage and learning just how one visit to the doctor a year can make all the difference. Destin.
The biggest problem medical professionals tell me is that when people feel fine, they think they are fine. Even though that usually is the case, yearly doctor visits are important because cancer can spread silently, quickly, and if caught early, can be managed.
I wish it didn't take somebody who's noteworthy to have cancer for people to start thinking about it. But if that's what it takes, so be it.
I think we have to put a lot more investment in making sure that people get screened.
Doctors are hoping that the recent death of Tobi Keith and diagnosis of King Charles can serve as a wake-up call to those avoiding cancer screenings. According to the OSF Healthcare Medical Director, screening numbers have seen improvements across the board. However, the recommendation of age when to get tested continues to change.
There's been a push on having people go to get screened. I think the screening numbers are actually are better than they were pre-COVID because people are kind of playing catch up. But they're also realizing that, hey, you know what, we need to kind of take care of ourselves. And in terms of numbers, it depends on the type of cancer.
The chair of medical oncology at the City of Hope Cancer Center, Chicago, says the pandemic, income, education, and a person's environment have all played a role in why people don't participate in cancer screenings.
We get some of our statistics from the south side of Chicago where we see a 30%, decrement in terms of women being screened for breast cancer as compared to some of the northern suburbs, as compared to some other areas in the Chicagoland area.
That's in addition to seeing a younger demographic of people ages 20 to 30 receiving cancer diagnosis.
And a lot younger people being diagnosed with pancreatic and colon cancer as well. And so that's just not a phenomenon just locally here, it's a national phenomenon. And so we're trying to figure out what's the cause of this. Is it pure genetics? Is there something that we can do on the screening side to get more people screened earlier?
Dr. Ahmad also wants to emphasize the importance of healthy relationships with your primary care doctor, because that professional is most likely to be the one who recommends a cancer screening. Brittany?